having radiotherapy treatment to the prostate and prostate bed. This video will discuss the different elements of your treatment and advise you on how best to prepare yourself for radiotherapy. An appointment will be made for you to attend the radiotherapy department for a planning CT scan. 2 weeks prior to this appointment, you will need to start getting yourself well hydrated. We recommend that you drink 2 litres of fluid a day, be this water, squash or herbal teas. We ask that you reduce the amount of alcohol and caffeine you take, as this will dehydrate you. A team member will contact you to discuss your individual preparation prior to this appointment.
When you enter the department, check in at the reception desk. Once you've checked in, take a seat and your name will be called over the tannoy system when it is your turn for treatment. At times there may be unavoidable delays. If this is the case, there will be a sign in the front desk as you enter the department. These delays may mean that you need to alter your treatment preparation. If you're unsure about this, feel free to ask the receptionist, who will contact a radiographer, and someone will be able to talk you through this process. On your first day, a member of the treatment team will collect you from the waiting room. You will have a consultation where someone will explain what we need you to do before your CT planning scan and radiotherapy appointments. We will guide you through this preparation on your first day. However, you will be required to carry out this preparation for subsequent appointments. 1 hour before your treatment time, you will be asked to use an enema. This is a gentle enema and will only empty the lower part of your back passage. Twist the top of the enema and gently insert into your back passage. Squeeze the tube like a tube of toothpaste and remove once empty. Pop in the bin in the toilet. After 15 minutes, you may feel the urge to go and empty your back passage. If not, we want you to try and empty any gas or matter. At this point, you will also need to empty your bladder. Once you've emptied your bladder and back passage, we want you to drink 500 ml of water. Drink this water within about 10 minutes and wait 30 minutes for your bladder to fill. After this 30-minute period, you should be ready for your treatment.
Once your discussion and preparation is complete, you will be brought into the CT room. We will ask for your name, date of birth and address to verify we have the correct person and the correct paperwork. The purpose of the scan is to gain a 3D picture of your anatomy to ensure the radiation can be positioned effectively. This is not a diagnostic scan. We are not looking for anything. This scan will be used purely for planning your treatment. In the room, you will be asked to remove your shoes and trousers, so we advise wearing something loose-fitting. The CT bed will be quite hard. You will have a support under your head, knees and feet. These will remain the same for every day's treatment, and they help us reproduce your position. If you are uncomfortable, please let us know so we can make adjustments, but we must know prior to the scan. The team will be communicating with one another and recording measurements. All we require is that you remain still and breathe away normally. We will step outside the room to start the scan, but we will be watching you at all times. If you need our attention, wave and we will return. A quick assessment of your bladder and bowel will be completed to ensure you are ready for the scan. Once the scan has been completed, you will be given some permanent radiotherapy tattoos. They are similar in size and colour to a small freckle, and you may not even notice they are there. The tattoo shouldn't hurt. You may just feel a small scratch whilst they are being made. These tattoos will ensure you are in the correct position for your treatment. Once we have a successful CT scan, it will be sent to your oncologist and the planning team, where they will carefully create a custom-made radiotherapy plan. This process can take 4 to 6 weeks, and you will be contacted towards the end of this time frame with an appointment to start your treatment.
For your radiotherapy treatment, one of the radiographers will come and collect you from the treatment waiting area. They will check your name, date of birth and address against the paperwork in their hands. This shall make sure that they are taking in the right patient for the right treatment. They will also ask you how you are feeling. This is an opportunity to discuss any queries you may be having or any side effects you may be feeling from the treatment. Once you're in the room for your radiotherapy treatment, the radiographers will line up your tattoo dots with lasers in the room. This shall make sure you are in exactly the same position each day for your radiotherapy treatment. Once the radiographers have lined up your tattoo dots, they will move the bed to your treatment position according to your specific plan. Once you are ready for your treatment, the radiographers shall let you know they are leaving the room. You will hear an alarm noise signalling this. We want you to stay as still as possible, but breathe away normally. First of all, you will see some arms come out of the side of the machine. These are our imaging arms. We shall take a quick picture of your pelvis first to assess the bladder and bowel preparation. The machine will move around you in an arc as we take this image. The radiographers will then assess this image to make sure that the bladder and bowel preparation has been carried out correctly. The radiographers shall check that the bladder is nice and full and the rectum is small and empty. They shall also make sure that the area the doctor has outlined is in exactly the right position for the treatment. If anything wasn't correct, the radiographers will come in the room and let you know, and they shall also inform you on how to correct for this. You may feel the bed move ever so slightly after this imaging has been taken. That is completely normal. That is just the radiographers moving the bed to your treatment position. Whilst your radiotherapy treatment is being delivered, the machine will move around you in a continuous arc motion. You won't feel anything with this treatment and you don't see anything. You'll just hear the machine making a buzzing noise, and that's when the treatment is being delivered. The time and dose of your treatment stays exactly the same each time. This doesn't change. After your radiotherapy treatment, you are free to go about your normal day. You won't be radioactive and you won't harm anyone. The radiation is only on in the room for a few minutes when the treatment is being delivered. Here are a few top tips that patients have given us feedback from to help with their radiotherapy journey. Number 1, wear loose-fitting trousers and slip-on shoes. This shall help make the process quicker for you whilst getting on and off the treatment couch. Number 2, bring 2 enemas and a 500ml water bottle to each appointment. Just in case the preparation wasn't successful the first attempt, having an extra enema already prepared will make things a bit quicker and smoother. Having a 500ml water bottle shall also give you the right amount of water to drink in preparation for your treatment. There are also plenty of water fountains located throughout the department if you did need to top this water bottle up. Number 3, bring the preparation guide to every appointment. We understand that there is a lot of information to take in and it can be all quite confusing. If you bring your preparation guide with you, it shall give you a detailed step-by-step account of the bladder and bowel preparation. However, if you do still have any queries, please do ask any of the staff as we are happy to help. Number 4, keep a 500ml bottle on you at all times. This is to ensure you are keeping hydrated throughout the day by drinking regular sips of water.
As a specialist team, our focus is on supporting you. We can only do this effectively if we are aware of your concerns. We rely on you to contact us if you would like support to manage the physical and emotional impact of your diagnosis and treatment. You will be seen throughout your radiotherapy treatment by a member of the uro-oncology team. We understand that it may not be easy to talk about some personal issues, however, would like to reassure you that you will be treated in confidence and with respect. There will be an opportunity to discuss any concerns that you have during your holistic needs assessment. Your package of care will be individualised to your needs, with the duration of radiotherapy and hormonal treatment dependent on the grade and stage of your prostate cancer. Your ongoing follow-up treatment will involve regular blood monitoring and contact with the clinical nurse specialist team for at least 5 years.
Hello, my name is Helen. I'm the uro-oncology support worker. I work with Dr. Sankey, Dr. Parslow and the specialist nurses. My role is very much one of support to our patients. I wanted to make you aware of the support services we have available in the mustard tree. These include counsellors, benefits advisors, complementary therapists, to which I can signpost you to. I can advise you with regard to exercise and diet and liaise with my colleagues in oncology regarding outpatients appointments, etc. If you would like a regular support call from me, please do ring our number, which is in your patient pack. If you have any concerns, questions, or you're needing help, I actively encourage you to ring me.
My name is Eddie and I was diagnosed with prostate cancer. I found the nurses were wonderful. I put it that way. They looked after me and they kept asking me, have you got any symptoms? Have you got this? Have you got that? And no. And they made me feel relaxed, at ease. I couldn't fault them one bit. And when I finished my treatment, I said cheerio to them all. And a couple of them I thought were going to burst into tears because we had a good chat and all that, and I said thank you very much. And don't forget to ring the bell. So as I came out, I rang the bell to say my treatment was finished, and all of a sudden everybody started clapping and cheering. And I felt, right, that's it, and I walked out. And people in the waiting room said, oh, we heard you finished your treatment? And I said, yes, I finished my treatment. I'm going home now.
Hello, my name is Jerry, and I'm here to talk about my experience of my treatment in radiotherapy. It was 6 weeks, excluding the weekends. It's a very relaxed atmosphere when you're on that bed. It's very comfortable. You have a neck rest, and they make sure that you are comfortable. The positioning is very precise. They measure you and they just say like shuffle down a bit or whatever. Very minute changes. And then you put your hands on your chest and the machine will go a little bit one way and then another way, and then you'll feel a little bump of the radiation. And the wonderful thing, when I first went into the room to change to get on there, one of the male nurses said to me, and what music would you like? And that relaxed me straight away, and I have a good sense of humour anyway. So it's all relaxing. And so they put on some music, and I was listening to music, and before I knew it, it was over. And they came out, because obviously the protected area they're in, and they said, it's all over, well done. And they said, we look forward to seeing you tomorrow. And I'm thinking, this is a good feeling. The treatment was like as if it was just something that was taken care of in a short space of time. So the anxiousness and the worry was all taken over by these documents and paperwork to reassure me, talking to people, and that you can ask questions to anybody. They're all there to help you, so there's no need to worry about anything.